Hi, I'm Dr. Nathan Ritter from cardiogauge.com. This video is an aspirin update. On March 17th, 2019, two major heart associations in the country, the ACC and AHA, changed their recommendations for aspirin use. So first of all, and most importantly, none of this applies to you, does not apply if you have a history of heart attack, stroke, stent, other blood vessel problem. That's not what all this news is about. This news is about people who have never had any of those problems and take aspirin to try to decrease their chance for stroke or heart attack. So anyway, that's number one. For decades, aspirin's been recommended to decrease chance for stroke and heart attack, and people have taken a baby aspirin once a day, 81 milligrams, thinking that they were helping themselves. But some recent studies show that the benefits of aspirin don't outweigh the risks of bleeding, either gastrointestinal hemorrhage, like a bleeding ulcer, that type of thing, or even worse, bleeding into the head. So these studies did not support the use of aspirin, especially in people over the age of 70. So, for example, a 70-year-old woman with diabetes and high blood pressure who previously took aspirin once a day to prevent stroke and heart attack, that's no longer recommended, and generally it's recommended to stop the aspirin. Of course, you have to talk with your doctor about it specifically. Doctors are still allowed to recommend aspirin for people from the age of 40 to 70 or so who do not have any risks for bleeding. So they've never had an ulcer, they don't take pain medications like ibuprofen or naproxen, which could increase their chance for bleeding. They don't have kidney disease, et cetera, et cetera. So certain people who are at low risk for bleeding and are at high risk for having stroke or heart attack still could be recommended to take aspirin. But most people really aren't going to fall into those categories. And for most people, the average person taking an aspirin a day won't be recommended. So this is how I'm dealing with aspirin now in my practice. If I've got somebody who's been taking aspirin for 30 years and hasn't had a stroke or heart attack and hasn't had any bleeding, it's hard to stop it because basically it's been working. So if it ain't broke, don't fix it. I tend to be that type of doctor. And that would count for somebody who was 75 years old and didn't have any other problems and had just been taking aspirin. I mean, that's how I do it. If somebody's not having a problem, things are working out, I tend not to change things. If I have a patient who I think is really at substantial risk, substantial chance for getting a heart attack or stroke, then I'll use aspirin to try and prevent that for them, even if they haven't had a problem before. Some examples of people who fit that category would be somebody with a really high cholesterol, like an LDL cholesterol of 190 or more. That's super high. That person's at really quite high risk, 50% or something like that, for stroke or heart attack over their lifetime. So I'm going to continue using aspirin for my patients who are like that. Another example would be someone who has a strong family history for early coronary blockage. So maybe a 40-year-old man whose father died at age 45 and whose uncles have all had bypass surgery or whatever. That person, I consider him to be very high risk, and aspirin, the use of aspirin, probably the benefits outweigh the risks in that patient. So there will certainly be patients who I still use aspirin for to prevent stroke and heart attack. Those would be the people who are at the highest risk, and also people who've successfully taken aspirin for decades. I'm not going to pull the carpet out from under them and get rid of the aspirin. It doesn't make sense to me. If something hasn't caused any trouble and nothing bad's happened while I've been taking it, then I would continue it. So that's how I am going to be using aspirin. It's worth repeating that none of this stuff applies to you if you've already had blood vessel problems, stroke, heart attack, stent. I've had so many of my patients who had a stent put in 6 months ago, and they're saying, "Oh, I hear aspirin's not good for me. Should I be stopping it?" And no, don't stop it if you've had those types of problems. Anyway, thanks for watching. Do me a solid, hit that subscribe button and thumbs up. It helps get the feedback, and see you next time.